Mental health issues are often casually thrown around in everyday conversations, with people frequently misusing medical terms. Feeling down is called depression. Mood swings are labeled as being bipolar, and someone seen as acting oddly might be dismissed as schizo. Such language stigmatizes those struggling with mental illness, slapping an abnormal label on them. Today, we're going to bust some myths about schizophrenia and tell you what it really is. If you dig our psychology videos, be sure to subscribe to the channel and spread the word to your friends. Schizophrenia is one of the most puzzling disorders, with symptoms mentioned as far back as ancient Greece, Egypt, and Rome. However, medicine was still pretty primitive back then, and mental health issues were hardly understood or treated. Even in the last century, doctors were clueless about how to handle schizophrenia, subjecting patients to horrifying practices. The disorder wasn't formally recognized until the late 19th century by psychiatrist Emil Kraepelin, who literally translated it as early dementia, grouping it with intellectual disabilities and senility. It took another 15 years for schizophrenia to be described as a distinct condition, with 4 main symptoms identified: autism, flattened affect, ambivalence, and loose associations. In plain English, that's reduced emotional expression combined with detachment from others, indecisiveness, and disordered thought patterns. Some of the archaic treatments for schizophrenia were downright inhumane and potentially life-threatening, like barbiturate administration, glucose deprivation, which could induce comas, camphor injections, electroshock therapy, and even lobotomies. During the eugenics craze, people with schizophrenia were also forcibly sterilized, essentially tortured. None of these methods actually helped, and the mortality rates were appalling. Modern psychiatry is still searching for answers about what triggers schizophrenia and whether it can be permanently cured. But we now understand so much more about this condition and can debunk many misconceptions. Schizophrenia is a mental disorder characterized by symptoms like hallucinations, delusions, disordered thinking and behavior, and personality changes. It's considered an endogenous disease, meaning it arises from internal rather than external causes. In other words, psychological factors like stress or trauma don't cause schizophrenia. Research shows it has a strong genetic component. If one parent has it, the child has a nearly 15% chance of inheriting it. With 2 affected parents, the risk soars to 60%. Other potential risk factors identified by psychiatrists include maternal infections during pregnancy, brain injuries, substance abuse, and childhood trauma. According to the WHO, around 24 million people worldwide, roughly 1 in 300, live with schizophrenia. The typical onset is around age 20, though late life and childhood onset cases exist too. We'll focus on the adult form, but mental health is just as crucial as physical health. Many assume schizophrenia automatically involves delusions and hallucinations, which are psychotic symptoms reflecting a break from reality. But those don't necessarily occur. Schizophrenia exists in several subtypes with varying symptoms and behavior depending on the disorder. With the simple form, no psychotic features manifest, but odd behavior progressively emerges, along with an inability to meet societal demands and reduced functioning across the board. There are no hallucinations or delusions, but significant personality changes. The person first loses interest in previous enjoyments and avoids socializing, becoming more passive, isolated, and emotionally indifferent, often neglecting hygiene and grooming. Wandering tendencies, repetitive stereotyped movements, and illogical, long-winded, almost speechifying monologues filled with empty rhetoric and formal analogies are common. Despite lacking hallucinations, it's still schizophrenia due to the disturbed psychological processes and personality deterioration characteristic of the illness. Other subtypes like hebephrenic, marked by childish silliness, and paranoid schizophrenia do involve psychotic symptoms alongside delusions and hallucinations. Hallucinations are false sensory perceptions, where the person sees, hears, smells, or feels things not actually present. They can be commanding, with voices instructing certain behaviors. Some are genuinely perceived in the surrounding environment, while others lack those real-world qualities and seem confined to the person's head. But hallucinations can occur in other conditions besides schizophrenia, like severe depression. Delusions. the other major psychotic symptom, are patently false yet immovably fixed beliefs. They're wildly illogical, implausible, and divorced from reality, yet stubbornly maintained. Often co-occurring with hallucinations, this delusional state could involve persecutory beliefs, like thinking people in red are stalking you, with corresponding visions of menacing red-clad figures. Delusions take different forms, like persecutory, grandiose, or self-blaming types, reflecting various preoccupying themes. Being followed, having an elevated status, or deserving punishment, respectively. Like hallucinations, delusions aren't exclusive to schizophrenia and can occur in delusional disorder, a separate condition. Other symptoms found across all schizophrenia subtypes include blunting or flatness of emotions, detachment, hostility, and irritability. Only psychiatrists can treat schizophrenia with medications. Numerous drugs exist to alleviate hallucinations and other symptoms, but there's no one-size-fits-all protocol. It can take years for a doctor to find the right combo of meds for a particular patient. The key thing is, schizophrenia is a chronic condition requiring strict medical supervision and adherence to treatment plans. With professional help, remission is possible, allowing people to live full, productive lives while managing their illness. So, in summary, schizophrenia is a legitimate neurological disorder, not just an insult for weird behavior. It manifests in diverse ways, sometimes without the stereotypical hallucinations and delusions. While the causes are complex, we've come a long way from the dark ages of schizophrenia treatment. With support and the right meds, many patients can thrive, a far cry from the inhumane cures of the past. Careful not to trivialize it as simply crazy talk. That's just ignorant. Spread some facts, not stigma. So let's recap what we know about schizophrenia and treat it with the seriousness it deserves. At its core, it's a brain disorder that profoundly disrupts how a person thinks, feels, and behaves. The specific symptoms run the gamut. Some folks battle terrifying hallucinations and delusional beliefs, while others mainly struggle with emotional numbness, social withdrawal, and cognitive impairments. No two cases look exactly alike, but one thing's for sure. None of the outdated treatments of the past, like lobotomies and shock therapy, did anything to truly help people get better. If anything, they just compounded the suffering. Thankfully, modern medicine has come a long way in understanding schizophrenia's biological underpinnings and developing more humane, effective therapies. These days, a variety of antipsychotic medications can manage the most disturbing schizophrenic symptoms like visual hallucinations and paranoid delusions. Of course, it often takes some trial and error to find the right dosage and drug combo. And meds alone aren't a magic cure-all. Therapy, social support, and self-care routines are crucial too. But at least we've moved beyond the dark age barbarity of freak shows and forced sterilization campaigns. The road to recovery and stability can be long and demanding for those battling this tenacious disorder. But with professional treatment tailored to their needs, many are able to get their symptoms under control and live independently in society. They can pursue jobs, relationships, and personal fulfillment, rather than being permanently shut away in asylums like human discards. That said, schizophrenia's causes are still not fully understood, and there's no guaranteed way to prevent it altogether, especially for those with close relatives affected by it. The genetic components are strong, but environmental factors from prenatal nutrition to childhood trauma can also seemingly play a role. Ongoing research aims to crack more of the neurological code. In the meantime, what's most important is continuing to destigmatize schizophrenia as some sort of depraved, horrible split personality bogeyman. That outdated, exaggerated media stereotype couldn't be further from the truth for most sufferers. While overcoming the internal battles and societal prejudices is undoubtedly challenging, schizophrenia doesn't have to define or confine a person's entire existence. With the right support system and treatment approach, many are able to manage their condition and live unlimited by its constraints. The key is spreading factual awareness, squashing sensationalized myths, and recognizing schizophrenia as a legitimate medical issue, not a punchline or justification to alienate others as crazy. A little empathy and open-mindedness can go a long way in breaking down unfair stigmas. These are human beings fighting an uphill battle, not raving lunatics to be mocked or discarded as lost causes. Widespread acceptance and access to care are what's really needed, not archaic attitudes straight out of the medieval ages.